Welcome to the Plastic Surgery Playbook. You do 1,000 crunches a day, perfectly dial in your diet, and lose all that superficial fat. And yet, when you look in the mirror, you still look 6 months pregnant.
Yeah, it is incredibly frustrating for so many people.
Right. For millions of women, that persistent bulge just isn't a lack of discipline. It is a severed internal anatomy that exercise literally cannot touch. So today, we are bringing you a comprehensive, totally realistic exploration of the full tummy tuck procedure.
Exactly. Because the goal today isn't just to, walk through some surgical textbook. It is about uncovering the hidden realities. We want to look at the true financial budget and the psychological phases of recovery so you are perfectly prepared.
Yeah, we are cutting through all the noise. And to anchor this, we are leaning heavily on the clinical insights of Dr. Shim Ching. He's a board-certified plastic surgeon practicing in Honolulu, Hawaii, and also over in the Middle East.
Right, specifically in Doha and Dubai.
Yes. And I want to be incredibly clear about why we are mostly using Dr. Ching's videos for this audio. It is a strictly data-driven choice, because you simply cannot ignore the fact that he has performed 30,000 tummy tucks in his 20-year career. I mean, if that doesn't make one an expert, nothing does.
The sheer volume of that experience is just staggering. When a single practitioner performs a complex operation tens of thousands of times, they master the absolute micro nuances. They see the 1 in 1,000 complications.
Yeah, that kind of longitudinal data is invaluable. And just to set a very clear boundary for you right at the top, this analysis is entirely focused on full tummy tucks. We are exclusively looking at the comprehensive procedure. We are talking about the full structural overhaul here.
Which is necessary for the vast majority of patients seeking this out. To really understand why a full procedure is the only viable option, we have to look under the hood at the root of the problem. Physical changes during pregnancy or major weight fluctuations, they create damage that diet simply cannot fix.
Okay, let's unpack this. Because society pushes this toxic misconception that you can just magically snap back. But structurally, the materials have been fundamentally altered, right?
Right, exactly. It is physically impossible to crunch your way out of this specific problem. To explain why, we can look at the educational material from Dr. Joshua Lampert, a plastic surgeon based out in Miami. He specializes in a condition called rectus diastasis.
Which is basically the separation of the six-pack muscles.
Yes. Normally, those muscles sit side by side right down the center of your stomach. They are held together by this tough band of connective tissue. But when a woman goes through pregnancy, the physical growth of the baby pushes outward with immense pressure.
And that pressure just causes that tissue to stretch out.
Right. It stretches, thins out, and in many cases, it tears. The two halves of the six-pack literally separate and pull apart from each other. And once that connective tissue is overstretched, like a worn-out rubber band, it never snaps back.
Okay, let me try an analogy here. It's like the zipper on a really overstuffed suitcase bursting open. You can take clothes out, which is like losing weight.
Yeah.
But until you physically repair the zipper itself, the bag will not stay closed, right?
That is a brilliant way to visualize the mechanism. It explains the why behind the bulge that so many women find so deeply frustrating. That severe projection of the lower abdomen, well, it isn't fat.
It's the internal organs, isn't it?
Exactly. It is the internal abdominal contents literally protruding outward through this weakened muscle wall. Dr. Lampert cited a specific surgical case where he had to perform a 10-centimeter repair just to pull the muscles back together.
Wait, 10 centimeters? That is almost 4 inches of empty space between the muscles. No amount of planking is going to drag muscles 4 inches across the abdomen.
Exactly. And this is why a full tummy tuck with muscle repair is the only valid medical solution. During the surgery, they use heavy, permanent sutures to physically drag those muscles back to the midline. They are essentially building a double internal corset from the rib cage down to the pubic bone.
So they're installing a brand new heavy-duty zipper. Okay, so the internal corset is laced up tight. But obviously, when a patient looks in the mirror, they are looking at the external aesthetic.
Right, the surface level.
Yeah. How do you ensure the final result doesn't look like you just had a major surgery?
This is where we really dive into Dr. Ching's playbook. Through those 30,000 surgeries, he has identified 4 common mistakes that inexperienced surgeons make. Mistakes that completely ruin a natural-looking result.
Let's start with the most obvious telltale sign, which is the scar. Dr. Ching points out that poor scar placement is a glaring mistake. What exactly defines poor placement?
It really comes down to the geometry of clothing. The ideal scar must be placed as low as physically possible on the abdomen. But beyond just being low, it needs to be gently curved to hide under a bikini or normal underwear.
Because if a surgeon cuts straight across or places it even an inch too high, it's going to peek out of the top of your swimsuit.
Exactly. Now, there is one exception to this, which is the fleur-de-lis tummy tuck. That adds a vertical scar straight down the center of the stomach. But that is strictly reserved for massive weight loss patients with severe excess skin.
Right. But for the standard procedure, avoiding a high straight scar is paramount. Which brings us to the second aesthetic mistake. And honestly, this one completely caught me off guard. The stuck-on belly button.
Yes, this is a huge one.
Wait, you can get a brand new belly button? Because my initial thought was, how do you fabricate an organ out of thin air? Does he just throw the old one away?
It's a common point of confusion. In an older style tummy tuck, the surgeon cuts a circle around your existing belly button and leaves it attached like a little mushroom. Then they pull the stretched skin down, cut a new hole, and pull the old belly button through.
Which sounds totally logical. You're just relocating the window it peeks out of.
It sounds logical, but it leaves a telltale ring of scar directly on the surface of the stomach. Dr. Ching argues that reusing the old one looks unnatural, like a coin has just been stuck onto the belly. It is a dead giveaway.
So what is his mechanical alternative? How does he bypass that surface ring?
He prefers creating a brand new, elongated oval shape. He places it at a more youthful height, but the real trick is how he sutures it. He pulls the abdominal skin down into the cavity of the newly shaped belly button.
Oh, I see. So he anchors the scar deep inside the tunnel itself.
Exactly. So the scar still exists, but it's physically hidden in the shadow of the belly button. There is no visible ring on the flat surface of the stomach.
That is brilliant engineering. Okay, mistake number 3 brings us back to the internal mechanics, which is inadequate muscle repair.
Right. We discussed the internal corset earlier. Failing to execute a tight plication of that muscle wall destroys the aesthetic. You are left with a stomach that might be technically flat to the touch, but still severely rounded and pregnant-looking in profile.
Like putting a tailored dress over a pregnant belly. The fabric is smooth, but the silhouette is wrong.
Exactly.
Which leads to the 4th mistake, a lack of liposuction. Now, if you are already slicing away massive wedges of fat and skin with a scalpel, why do you need lipo?
Because failing to lipo the frame around the surgical zone leaves incredibly unnatural bulges. Dr. Ching specifically targets the upper abdomen, the flanks, and the mons pubis at the base.
Okay, so he focuses on the entire perimeter of the surgery.
Precisely. If you only flatten the front of the stomach, you get these profound contrast issues. It looks completely disproportionate, and this is specifically what causes dog ears.
Right, I looked at the geometry of dog ears. You're taking a flat incision and wrapping it around a curved hip bone.
Exactly. If you don't use lipo to thin out the tissue at the corners, the excess skin and fat pucker outward, you absolutely must use liposuction to blend the areas for a natural result.
So a perfect tummy tuck requires a massive amount of surgical labor. The internal corset, precise scar placement, a custom belly button, and extensive lipo. Which brings us to the financial reality. Let's unpack the true budget here.
The sticker shock is incredibly real. Dr. Ching notes that the average cost across the U.S. can range anywhere from $6,000 to $35,000.
That is an unbelievably wide range for the exact same named procedure. How does that even happen?
You have to look at the 3 core fees. First is the surgeon's fee, where you are paying for their experience and aesthetic judgment. This is simply not the place to bargain shop. Second is the anesthesia fee, paying an anesthesiologist for 2 to 4 hours of OR time.
Right, and the third is the facility fee, depending on if you use a hospital or a surgical center. But here's where it gets really interesting. It's the hidden costs that nobody mentions.
Yes, the out-of-pocket expenses that catch patients completely off guard.
Dr. Ching has a very pragmatic list of these, like compression garments, which run $80 to $200 each, and you need at least 2 of them. Then you have prescriptions for painkillers and antibiotics, which is another $50 to $200.
And you can't forget scar treatments. Medical-grade silicone sheets and creams will easily consume another $100 to $300.
But even those pale in comparison to the lifestyle costs. You need a strict minimum of 2 weeks off work. That is 2 weeks of potentially unearned income. And the absolute biggest shocker is the childcare restrictions.
Yes, this is crucial for new mothers.
You cannot lift young children for 8 full weeks. You are forbidden from lifting anything over 5 pounds. If you don't have a partner with immense flexibility, you have to hire outside help, which could add thousands to the bill.
It is a severe reality check. And it provides the perfect transition into the physical and psychological recovery because the surgeon only executes the first half of the process.
So let's talk about the 30,000 surgery recovery reality. What does it actually feel like when you wake up?
Dr. Ching uses a brilliant benchmark. He tells mothers that the initial 2 to 3 weeks of pain and limited mobility feel remarkably similar to recovering from a C-section.
But how do they manage that immediate intense pain?
While the patient is still in the OR, Dr. Ching injects a long-acting local anesthetic mixed with steroids. That chemical combination buys the patient 12 to 20 hours of real relief before the real soreness kicks in on day 2 or 3.
Okay, so the block wears off and you're in week 1. This brings us to the swelling paradox. You will be hunched over for 2 weeks to protect the incision. And shockingly, you will look visibly more swollen on day 4 than you were on day 1.
The panic this causes is intense. Patients legitimately believe the surgery failed, but it is just the body's inflammatory response rushing fluid to the wound area to heal it.
Which drags us straight into weeks 2 and 3, the ugly middle phase.
This is the highest period for panicked phone calls. Because the sharp pain is mostly gone, your brain says, hey, I'm normal. But your body is unevenly swollen and the belly button looks weird.
And patients just feel incredibly frustrated.
They do. In fact, Dr. Ching observes that 30 to 40% of his patients get post-surgical blues during this window. It's a real emotional toll from the trauma, the meds, and limited mobility.
But let's say you push through that, and we arrive at weeks 4 to 6. Now, if you are feeling better by week 4, why is this called the danger zone?
Because patients feel good and they overdo it. They do heavy lifting or intense gym sessions. This creates immense friction between the internal layers of tissue.
And what's the actual mechanical risk of that friction?
It causes seromas, which are fluid collections under the skin. It's like a massive blister deep under your stomach, and it completely ruins the healing process. You have to actively restrain yourself.
Right, because the final result you see online doesn't happen at 6 weeks anyway.
Not at all. It takes 6 to 12 months for the final 15% of swelling to drop. It takes a full year for the scar to fully mature.
It is truly a marathon. But as we wrap up, there is one unexpected benefit within the source material that we haven't touched on yet.
Yes, and it shifts the conversation completely away from pure vanity. Beyond just the cosmetic changes, physically repairing that separated muscle wall fundamentally alters your biomechanics.
Right. Tightening that core actually relocates the abdominal muscles back to the midline.
Exactly. It strengthens the core so significantly that the abdominal muscles can finally balance the physical load with the back muscles again. As a direct result, many patients experience a massive improvement in chronic back pain.
It completely reframes the narrative. It gives you a completely different lens through which to view the physical and financial investment. Thanks for listening to the Plastic Surgery Playbook.